infertility is not only a female issue. There have been umpteen number of awareness campaigns, and also there are a lot of doctors who are talking about it. And if you go ahead and read it, it's all out there that female and male infertility are equally responsible. So the female partner and the male partner equally responsible when a couple is kind of facing challenges conceiving. Half of the times it's a female factor, half of the times the male factor, and most of the times it can be a combined factor as well. So it can be a male and female factor due to which a couple is not able to conceive. This is absolutely untrue, that if you've conceived once and if you've had one child and you have not faced any challenges while conceiving, that you will not face any challenges while trying to conceive the second time around. There is something which is known as secondary infertility. Secondary infertility is a terminology which is used for couples who have conceived the first time around but are facing challenge to conceive the second time around. So if you've completed your family with one pregnancy and you've had one child, does not mean that you'll have a smooth sailing journey the second time around. You can face challenges as well. Triplets is an absolute no-no in today's practice. But twins, yes, you can have twins when you are undergoing an assisted reproductive technology or an IVF. However, that also the incidence is declining because most good practices are now moving towards a single embryo transfer. So what happens is that when we are transferring two embryos in an IVF cycle, then the outcome can be no pregnancy, one pregnancy, or two fetuses attaching, and you can have a twin pregnancy. So this is what happens when two embryos are transferred. When one embryo is transferred, that is when a single embryo transfer is done, the chances of you having twins goes down considerably. Why am I saying it goes down? Because in an odd event like 0.5%, you can have this one single embryo which is transferred, which can go and split into two and can give you a twin pregnancy. I've had it personally in my practice. So it can happen, but definitely the chances of you having a twin pregnancy, even after transferring a single embryo transfer, is close to zero. I'm not saying zero, it's close to zero. The sperms in the semen have a forward motility. So the sperms in the semen are actually motile. They are moving in an upward direction. So whether you are lying down, sitting, whatever you do, keep your legs up, whatever you do, the sperms are going to move in the direction that they are supposed to be moving in. So it does not get affected by your posture or you keeping your legs up after you've got intimate, etc. The sperms are going to do their job. So it does not matter the position while you're getting intimate. It does not matter at all. And it doesn't enhance or hamper your chances of getting pregnant. We usually say that if a woman, the age of the woman in the couple is less than 30 years of age, then if they've been trying for more than a year, then they should seek, at least a consultation with a fertility specialist. And if the age of the woman is more than 30 or 35 years of age and they've been trying to conceive for more than 6 months, then, they should seek help or they should consult a fertility physician. So from this, we understand that it takes from something like 6 months to a year for us to say that yes, they have tried, and they're not able to conceive. So an average couple may take somewhere close to 6 months to a year to conceive pregnancy. Ideally speaking, yes, if you getting intimate during your periods, you shouldn't get pregnant. But of course, there have been case reports, so you should not take it very lightly. there is an odd menstrual cycle which is there, where the sperm basically can survive. So you're not ovulating definitely during your periods, but the sperm can survive for as long as 7 days. So if the sperm is alive and you've got a shorter menstrual cycle and you ovulate earlier, then you may get pregnant even while you had intercourse during your periods. So, of course, there have been case reports, but it's very unlikely that something like this happens. But it's always better to be, if you're not planning a pregnancy, to be safe than sorry.